When Priya Matthew recovered from a mild case of COVID-19 in November, she thought she was out of the woods. Then came long COVID.
At one point, I counted 23 symptoms. The most alarming ones were shortness of breath, labored breathing, heart palpitations.
One of the most crippling symptoms was insomnia.
Nothing worked. I would just lie awake in agony all night, and it felt like electric shocks going through my body from my head down to my toes.
Dr. Emmanuel During has been seeing that in sleep patients at Mount Sinai Hospital. For those with long COVID, he says insomnia is often related to pain and is resistant to treatment.
Pain which can occur at night as well, and a lot of autonomic imbalance, autonomic impairment, which is the ability of our body to control heart rate and blood pressures. That can lead to episodes of palpitation, night sweats.
Even for those without long COVID, the pandemic has robbed Americans of their beauty rest. In a 2022 survey, nearly a third said they'd experienced sleep disturbances since COVID began. That's down from 56% the year before, a phenomenon described as COVID-somnia. Priya Matthew shared her battle in a column for Axios.
When you're so sleep deprived, how does that impact your day?
I mean, I couldn't work for a month, at least. Any little task took way too much energy. Just taking a shower, I had to rest for, 3 hours after that.
Doctors say it's critical to stick to your best sleep hygiene, regular bedtimes, and no screens late at night, with the hope that as the pandemic fades, we'll all get the sleep that's so essential to our health. Michael George, CBS News, New York.